Hi, once again, welcome back to Obstetrics and Gynecology videos. Today, we are going to see about an abnormality of the pregnancy, that is post-maturity or post-term pregnancy. Now, we are going to see the definition of post-maturity or post-term pregnancy. If the pregnancy is continuing beyond 2 weeks of the expected date of delivery, that pregnancy we are calling as post-term pregnancy or post-maturity. We know the normal duration of pregnancy is 40 weeks or 290 days. And if it is more than 294 days, or if the duration of pregnancy is coming up to 42 weeks, that pregnancy we are calling as post-term pregnancy or post-maturity. The incidence rate of post-maturity is 4 to 14% and the average is about 10%. The causes for the post-term pregnancy includes wrong dates. Wrong dates means if the person is not sure about the last menstrual period. Sometimes if it is a wrong thing, we may think the total duration of pregnancy is more than 40 weeks. That is one reason. And another one is biological variability. Biological variability means sometimes as per the hereditary or as per the area or where the person is residing, sometimes minor variations may be there. And another one is maternal factors like primiparity. This delay is most common in the case of first pregnancy. In the subsequent pregnancy, normally that delay you may not be able to see. And previous history of post-term pregnancy. If the mother is having the previous history of post-term pregnancy, there is a chance for recurrence in the subsequent pregnancy also. And sedentary habits. Sedentary habits, if the person is not an active worker or hard worker, if the lifestyle is sedentary lifestyle, there is a chance for delay in the onset of labor. And elderly multipara, in the case of elderly grand multipara or in the case of elderly multipara, if the age of the lady is more than 40 and if she is having more than 3 children, in that case the elasticity of the muscles may be very high, tone of the muscles may be very poor, and that leads to the delayed onset of the labor. And the fetal factors include congenital abnormalities of the fetus. Other one, placental factors. If sulfate deficiency is there or if estrogen deficiency is there, in that cases there is a chance for delay in the onset of the labor. Sulfate deficiency and estrogen deficiency or reduction in the amount of estrogen. Next is the ways to or methods to diagnose the post-term pregnancy. First one, we have to take a thorough history about, especially about the menstrual history of the lady. It helps you to get an exact picture about the LMP of the mother, that is last menstrual period date. And another one, you can go for the clinical findings. First thing, we can check the weight record. Weight of the baby will be increasing, so naturally the weight of the mother also will increase when the pregnancy is advancing. And another one is abdominal girth. Sometimes after 40th week, due to the reduction in the amniotic fluid, the abdominal girth may decrease, so it also suggests. And the lady will be having history or she will be having the complaints of false pain. In between she will be having uterine contractions and she will get the pain due to that. And we can perform the palpation also. In the palpation, if you are able to identify the fetal parts very clearly, it shows that the amniotic fluid amount is decreasing. And even you can perform the vaginal examination, that is internal examination, to rule out the descent of the head or whether any progress is there, whether dilatation of the cervix is there. In order to identify such things, you can do even the internal examination also. And investigations purposes are in order to confirm the fetal maturity and in order to detect the placental insufficiency. When the pregnancy gestational age is advancing, the capacity of the placenta will decrease or aging of the placenta will occur, especially after 40th week. This aging symptoms of the placenta will be more severe, so incarceration of the placenta will be there. So when the placenta is getting aged, the placental supply or the blood supply to the baby also will decrease, so the vitamins and minerals which is available for the baby also will decrease. And for confirming it, you can go for the ultrasonography. You can perform the amniocentesis and you can assess the amniotic fluid index also. Otherwise, you can take the straight X-ray abdomen. These are the confirmatory things. And you can go for the NST, that is non-stress test. And this NST I'll be dealing in another video. Soon it will be coming. You can go through that. And another one is taking the biophysical profile, that is parameters like Manning score, the fetal movement count, all those things you have to see. That also I'll be giving you a separate video. And you can confirm by ultrasonography, you can take the amniotic fluid intakes, you can go for the Doppler velocimetry. All these things will help you to identify the fetal well-being, whether the fetus is active, whether the fetus is getting adequate amount of oxygen, vitamins, is there any symptoms of fetal hypoxia. All those things you can identify by using these methods. And you can go for the clinical findings, that is we can check the general appearance of the baby, you can check the weight of the baby, you can assess the amount of amniotic fluid, you can see the condition of the placenta, you can see the condition of the umbilical cord. All these things are possible in the USG, in the ultrasonography. The complications of postpartum pregnancy can be divided into complications during pregnancy, during labor, and after the delivery. The complications during pregnancy include fetal hypoxia and fetal distress. Already I have told you that aging of the placenta will occur and the placental supply will decrease, and that leads to the inadequate oxygenation to the baby, and that produces a fetal hypoxia, and further it may produce a fetal distress, and diminished placental function will be there. And I have already told you the placenta oligohydramnios, that is the amount of amniotic fluid also will decrease, and there is a chance for meconium stained amniotic fluid, because when fetal distress is there, naturally the baby will pass the meconium, so you can see the meconium stained amniotic fluid also. Next, during the labor, also there is a chance for fetal hypoxia and acidosis of the baby. There is a chance for labor dysfunction, because when the age is progressing, size of the baby will increase. We know that. So when the size of the baby is more, there is a chance for cephalopelvic disproportion, or there is a chance for delay in the progress of the labor. And chance for meconium aspiration, already I have told you that due to the fetal distress or due to the decreased oxygenation to the baby may pass the meconium. And there is a risk for cord compression due to the oligohydramnios. This also already I have told you, oligohydramnios will occur because when the blood supply and other vitamin mineral supply to the baby is decreasing, naturally the urinary output from the baby also will decrease, and that will leads to the oligohydramnia. That is the main reason for the oligohydramnia. And due to the oligohydramnia, there is a chance for compression of the placenta and compression of the umbilical cord. And another one is shoulder dystocia. When the size of the baby is increasing, naturally the biacromion diameter also will increase, and that may lead to the shoulder dystocia during the process of labor. And another one is there is a chance for birth trauma. Naturally, when the size of the baby is increasing, you may go for the instrumental delivery, forceps or vacuum. And when you are going for the instrumental delivery, chance for trauma or injury is more, and chance for operative delivery. These are the main complications that you can see during the labor. Next, after the birth of the baby, when the baby is passing meconium, this meconium will be there in the amniotic fluid, and the baby may aspirate this meconium stained amniotic fluid, and there is a chance for chemical pneumonitis and atelectasis and pulmonary hypertension due to the meconium aspiration. And after the birth also, due to this, the baby will get the hypoxia and the respiratory failure, and chance for hypoglycemia and polycythemia is there. And because of these reasons, there is a high chance for admission in the NICU. And the maternal complications include, there is a chance for induction of the labor, chance for instrumental delivery is there, chance for operative delivery is also there. Because naturally when you are going for the instrumental, if the size of the fetus is more, you will go for the instrumental delivery, and if the instrumental delivery fails, you will go for the operative delivery. So the chance for all these problems are there. Here we can see the scheme of management of post-maturity. First, before going for the management, we should see the condition of the baby. So that is, you should see the fetal surveillance. For that, you can go for the non-stress test. You can take the amniotic fluid index, and you can assess the biophysical profile. You should go for these things, and you should identify whether complications are there or not. If there is no complications, or if it is an uncomplicated pregnancy, if all these parameters are normal, you can go for the induction of labor within 7 to 10 days. And when you are inducing, you should see the condition of the cervix. If the cervix is favorable, you should see the condition of the cervix. If the cervix is favorable, you just go for the stripping of the membrane and perform artificial rupture of the membrane. these things, you can go. It will stimulate the labor process. And after rupturing the membrane, you should see the condition of the amniotic fluid. If the amniotic fluid is meconium stained, the management is separately, it's given over here, that I will be telling finally. If the amniotic fluid is clear, you just start the oxytocin, and it will end up with the, or go for the normal vaginal delivery, expect for the normal vaginal delivery. Okay, if the cervix is unripened, or if the cervix is not favorable for the oxytocin, if the uterus is not favorable for the oxytocin, you just give the prostaglandin E2 gel vaginally and makes the cervix favorable. And once if the cervix is ripened, go for the artificial rupture of the membrane and see the condition of the amniotic fluid. If it is meconium stained, the management is here, and if it is clear, the same management already I have explained. You can go for this management. Okay, and if the condition is complicated, when you are assessing these parameters, if it is a complicated pregnancy, or if you are suspecting complications, you can go for the same assessment of the cervix. If the cervix is favorable, do the artificial rupture of the membrane, do the electronic fetal monitoring, and after rupturing the membrane, already here I told you that you should see the condition of the amniotic fluid. If it is meconium stained, the management, this I will explain finally. If it is clear, not meconium stained, you can go for the normal vaginal delivery. And if the cervix is not favorable, and if it is a complicated pregnancy, go for the cesarean section. That's the management. Okay. And in all these cases, if the amniotic fluid, after the rupture of the membrane, if the amniotic fluid is meconium stained, if the liquor is meconium stained, you just go for the electronic fetal monitoring. You should go for the cardiotocography and assess the well-being of the fetus, and see the viability of the fetus. And if the fetal behavior is satisfactory, you can go for the vaginal delivery. And if the symptoms of fetal acidosis or fetal distress is there, means you can go for the cesarean. So that's all about the post-maturity. So far we have seen the management and how it is affecting the mother and baby. All those things we have seen. So thank you for watching this video. We'll be meeting soon with the next video. Till that, bye.